Thank you, Mr. Chairman. I'd like to thank you and the ranking member for holding this hearing. Madam Secretary, thanks for coming back. If I had to sum up the last 2 years of my town hall meetings in Colorado on this issue, what I would say is that what people are saying is we hated the system as it existed, the health insurance system. And we also believe deeply in your capacity, my capacity, not yours, to make it even worse than it is now. And I think the rancor of the debate on health care didn't do much to create a level of confidence in all of this. And one of the things that I talked about was that when people said, we don't believe government can do a good job here, look at what government has done before, I said, you have a point. And at the heart of this reform, in many ways, is an attempt, a rare attempt, to actually change the incentive structures so that we can deliver higher quality at lower cost, something that we have historically not done, but something we have to do, not just for the health of our citizens, but for the quality of the care that we've got, and so we don't bankrupt the United States of America. So one of the things I learned during the health care debate was that because of the way the incentive structure worked, 1 out of every 5 Medicare beneficiaries that went to the hospital were readmitted within a month for conditions that were completely preventable. And Medicare, as a result, was spending $17 billion a year on these hospital readmissions that could have prevented. And it's one of the reasons why I work so hard on something called the Community-Based Care Transitions Program. This innovative model ensures that each Medicare beneficiary at risk of being readmitted is assigned a coach who makes sure that they go in and out of the hospital, nursing home, and even their own home, and that they do the follow-up care and take their medications. This practice, known as transitional care, has shown a reduction of up to 50% in places with high readmission rates. And I'm very proud that this was homegrown in the state of Colorado based on work in Mesa County and Denver. And Madam Secretary, I just wanted to ask whether you're seeing this across the country. Are people starting to think about how we change the delivery model to create higher quality at a lower price, and what can we do to accelerate that work?
Well, Senator, I think that's a great question. The earlier discussion really focused on some of the insurance market changes, but I think the underlying health costs and the amount that is spent on things that may not lend themselves to the health of anyone are areas that providers and employers and others are eager to work on. And the case of this, coordinated care strategy once someone leaves the hospital, we know it works. It's in pockets around the country, but never really taken to scale. It's better for patients. It's better for their families. It's better for their health, and certainly lowers costs of unnecessary readmission. So having an opportunity to employ those best practices across the country, deploy those tactics, that bundled care, the medical home model, which we know is, again, very successful, the kind of early intervention, a lot of those strategies are incorporated into the Affordable Care Act and give direction to our agencies to implement those across the board, and I think that will be very good for the American public's health and for our health care costs.
I agree, and I will say I think it's been lost in the debate, which is why I raise it here today. And the providers in my state that are working on these things, and in many ways have some of the most forward-leaning approaches to this, are really excited about the possibilities here. And that really brings me to my second point, which is that we've heard discussion on both sides today and throughout the debate about the CBO numbers. Does this really save money? Is it going to save money over time? I think the honest answer to that question is it depends on how well we execute. It depends on how well you execute. It depends on how well the states execute. And it's one of the reasons why I worked with Senator Hagan and Senator Warner on a fail-safe amendment that would have said, look, if we don't save the money that we are committed to save, that we have said we would save, that we will look at it again as a Congress and make sure we have those savings, because we want to keep faith with the American people who reasonably are saying, we're not sure what to believe. We're not sure which side is right. And since it's a projection, we don't really know. My own view is that if we put more of these transitional care models, then we may save even more money than we've talked about. So I wonder whether you'd be willing to work with me and Senator Hagan, Senator Warner, and other members of the committee to see whether we might be able to write a piece of legislation that could give the American people confidence that when we say we're going to save the money, we mean we're going to save the money.
I'd be delighted to do that.
Thank you. Thank you, Mr. Chairman.